Okay, hello everybody. This is your lecture on the effects of massage. I really enjoy giving this lecture because I think that most people don't realize how incredibly beneficial massage is. Not only is it beneficial for every system of the body, but it's beneficial for the therapist when you're giving massages. And I like to give this lecture first before we go into contraindications because some students have said that contraindications has felt overwhelming and they were afraid to work on people. And I want to make sure that you have a good, strong foundation on why we want to give massages on a regular basis, why you want to receive massages on a regular basis. So let's jump in. I'm going to break this down by body system. Starting with the cardiovascular system. Massage will dilate your blood vessels, improve circulation, decrease your blood pressure, stimulate the release of acetylcholine and histamine, and replenish nutritive material. Improving blood circulation is a benefit that most people would have listed. Most people are well aware of that. They may not know that by mechanically assisting the venous flow return to the heart, remember your veins have no muscle. They're dependent upon your skeletal muscle contractions to pump the blood back to your heart against gravity. And when you compare massage to exercise, it's pretty much a 1-to-1. The return of blood flow to the heart is about 1-to-1 for massage versus working out, which is about 3 times more circulation than you would have at rest. Decreasing blood pressure, that is both diastolic and systolic, and that lasts for about 40 minutes after the massage. Stimulating the release of acetylcholine and histamine. That's the result of the vasomotor activity, and that helps prolong vasodilation. It's a relaxation effect, and so all the benefits you get with relaxation effects, and we'll talk about that farther on in the PowerPoint. More cardiovascular, it promotes removal of waste products. It reduces ischemia, which is a medical term for lack of oxygen to tissue. It is directly linked to pain and to trigger point formation. It does reduce heart rate through activation of relaxation response. It increases your stroke volume, which means the amount of blood sent from the heart during the contraction. So if there's a longer pause between heartbeats, more blood fills up in the left ventricle, which means more blood moves through the system with each contraction. It's less work for your heart. Athletes really are very concerned about increasing their stroke volume. Massage can do that for you. It does increase your red blood cell count, both the number of red blood cells and their capacity to carry oxygen. This is due to, 1, an increase in the spleen's discharge of red blood cells, 2, the returning blood from engorged internal organs into the general circulation, and lastly, stimulating stagnant capillary beds into returning blood to circulation. So you can expect an increased oxygen saturation in the blood, increased white blood cell count, which I'll go into in more depth later. It enhances the adhesion of migrating white blood cells to their surface, and it increases the platelet count. For the lymphatic and immune system, massage promotes lymph circulation, which also is dependent on muscular contraction, pressure changes in the thorax and abdomen, or pressure from massages. It reduces edema, which is swelling typically around ankles or wrists, and we'll talk more about that. It decreases the circumference area that was affected by the edema, which also decreases the weight gain in patients with edema. Because of the fluid retention, they tend to urinate extensively after the massage. There's an increase in the lymphocyte count. Lymphocytes are a type of white blood cells. You may have more, after a massage, you will have more white blood cells, and the phagocytes are more aggressive, meaning your immune system is stronger after a massage. It's a great way to market in cold and flu season, is to let people know that they will have better immunity to the common cold if they receive regular massages. Let's talk about the effects on skin. Massage increases skin temperature, which is an indication of reduced stress. It improves your skin's overall general condition. So as circulation increases, there's added nutrients available to the skin, added oxygen. This improves texture and tone and the appearance of the skin. Massage stimulates the oil glands, which reduces dryness. It improves the pathological skin conditions. So unless a particular skin condition is a contraindication for massage, massage can actually help decrease redness, reduce thickening or hardening of the skin, improve healing of skin abrasions, reduce itching, etc. So it can actually make someone with a skin condition feel more comfortable. For the nervous system, it definitely reduces stress. It reduces anxiety. And that is something that's been very well documented. The reduction in anxiety is an effect experienced by both the client and the therapist. So you as a therapist can actually have less stress in your life by giving massages. It promotes relaxation, which in turn diminishes pain. It decreases beta wave activity. So beta wave is the level of alert consciousness that's used when you're really concentrating on something like doing your taxes or balancing your checkbook. We know that these are decreased with massage. This is confirmed by electroencephalogram. So we also know that it increases your delta wave. Delta wave is measured at your deepest level of sleep or meditation. It is very, very calm. It's when your body is actually primed to heal itself most effectively. It increases alpha waves, which is your calm, alert brain waves. Those are the best brain waves when you're test taking. You don't want to be in beta when you're test taking because it's actually more difficult to recall. And alpha is the best brainwave for recall. So massage increases your dopamine levels. It increases your serotonin levels, which may inhibit pain. It does reduce your cortisol levels by activating a relaxation response. Cortisol is bad because it can inhibit your immune function. One of the reasons you frequently hear that stress is bad for you, and stress is like the beginning of all disease, is that stress is directly linked to the production of cortisol, and the cortisol does inhibit the immune system. It reduces your norepinephrine levels and your epinephrine levels. It reduces your feelings of depression. Both chemical and electrophysiological changes confirm this. It decreases pain, which in turn decreases the use of over-the-counter medications, NSAIDs, and analgesics. It does activate your sensory receptors. Depending upon the factors such as the massage stroke that you choose, the direction, the speed, and pressure of massage, they can all stimulate different sensory receptors. And this is how we as massage therapists choose to create different effects in our client. Muscle spindles activate muscular contraction, whereas a slow passive stretch and deep effleurage activate the Golgi tendon organ, thereby inhibiting contraction. So activation of pressure receptors can reduce pain through the gate theory. So we can pick and choose our hand strokes to create a different effect for our client. Another massage effect on the nervous system is a faster and more elaborate development of the hippocampal region of the brain. So the hippocampus is part of the limbic system, and it's related to superior memory performance. That's another great way to market. So on the muscular system, massage relieves tension. That tension, can I tell you, is the number one reason people seek a traditional doctor. Muscle tension leads to joint tracking disorders, and that leads to degenerative joint diseases. Don't think just of the knee, but also think of the spine. So degenerative disc disease, herniated disc, all are caused by muscle tension. So massage relaxes muscles, reduces muscle soreness and fatigue. It reduces trigger point formation, and it manually separates the muscle fibers, which allows for better circulation and improved nutrient delivery to the muscles. It increases range of motion at joints, improves performance, directly related to a person's improved balance and posture. Massage lengthens muscles, increases flexibility, tones weak muscles because we can choose to activate the muscle spindles. It reduces creatine kinase activity in the blood. That's a particular enzyme that helps ensure there's enough ATP for muscle contraction. So by decreasing that particular enzyme, you can decrease the muscle spasms that people have. Your clients who get Charlie horses or athletes who cramp up, you can actually help decrease the cramping. For the connective tissue, massage reduces keloid formation. A keloid is a scar that continues to develop. You could consider it an excessive scar. It does reduce excessive scar formation. It decreases connective tissue adhesions and fascial restrictions. It increases mineral retention in the bone. This is huge. Did you know that all these people who are going to the gym and lifting weight and they want to build really big muscle, your muscle size is directly related to the quality of the bone that supports the muscle. In other words, if you have osteoporosis, your muscles are never going to develop a great deal of tone because your body would not allow that muscle to pull on a frail bone. So by increasing mineral retention, you can actually improve muscular development as well. Massage promotes fracture healing. It improves connective tissue healing. So that is something specific to deep pressure massage only. With deep pressure massage, you get an increase in fibroblasts, which lay down collagen in the connective tissue. So a lot of people ask me about this. Does massage reduce cellulite? Yes and no. It doesn't eliminate the fat that has been deposited in the region, but it does eliminate it temporarily softens the connective tissue that is squeezing the fat and causing the dimpling appearance on the skin. So that can be either kind of cool, or please know that is a temporary effect. Respiratory. Massage's effect on the respiratory system. Massage does reduce your rate of respiration. It strengthens your respiratory muscles. It decreases the sensation of dyspnea, which is labored breathing or difficult breathing. It decreases asthma attacks. And so I'm going to say that means fewer asthma attacks, not necessarily less severe. It reduces laryngeal tension, which is important for people who make their living with public speaking or singers. It does reduce the tension on the larynx, which makes it easier for them to perform. It increases fluid discharge from the lungs, really important in pathological conditions like cystic fibrosis. Any condition that causes fluid to build up in the lung, massage can assist with that. It does reduce your rate of respiration, meaning you're going to take slower, deeper breaths, much better for your health. It improves all pulmonary functions, including increased vital capacity, increased forced vital capacity, increased forced expiratory flow, and increased peak expiratory flow. All professional athletes measure these. It is an indication of how much oxygen can be delivered to your tissue. Massage's effect on the digestive system. It promotes evacuation of the colon, relieves constipation, relieves colic and intestinal gas. That's a direct result of the increased peristaltic activity of the intestines, and it stimulates digestion because it takes us out of sympathetic nervous system and puts us into parasympathetic nervous system, which is all about rest and digest. In the urinary system, there's an increase in urine output after a massage because we're affecting dormant capillary beds and we're recovering lymphatic fluid for filtration by the kidneys. Massage promotes the excretion of nitrogen, inorganic phosphorus, and sodium chloride through the urine.